I thought after 86 Ministry of Health meetings, you would not be interested at all in what I had to say. Gary, congratulations. What a wonderful honor. Well deserved. Thank you to AMO President Robin Jones, Cousin Jones, and the members of the AMO board for an opportunity to be able to speak to you once again this year. Municipalities play a key role in our healthcare system, and our government is grateful for your partnership in building healthier, stronger communities across Ontario. Under the leadership of Premier Ford, our government continues to make record investments to protect and strengthen Ontario's world-class healthcare system, something we should all be proud of. Since I spoke to you last year, we have made significant progress through bold and innovative action to make it easier for patients and their families to access care closer to home. With our primary care action plan, supported by a historic investment of more than $2.1 billion, our goal is to transform frontline healthcare in each of your communities by connecting everyone in Ontario to a publicly funded primary care provider by 2029. It is an ambitious goal. But this year alone, our government has announced over 130 new and expanded primary care teams focusing on communities with the highest number of residents without a primary care provider. These teams will connect 300,000 more people in every corner of Ontario to reliable healthcare services tailored to their local needs. Take Temiskaming Shores, for example, where the Great Northern Family Health Team will be attaching more than 3,300 people to world-class care. Or in London, where the Thames Valley Family Health Team will be attaching more than 11,500 people to stable primary care. The impacts of our investments have already been felt in your communities. Since January of this year, the Health Care Connect waitlist, the waitlist where people are literally looking for a primary care provider, has dropped by more than 30%. We are so motivated to keep that momentum going. With the next round of primary care expansion launching this fall, we are well on our way to attaching every Ontarian to a connected and convenient care they deserve. We also know that we need a strong and growing healthcare workforce to support this ambitious plan. That is why, since taking office, our government has added a record-breaking number of nearly 100,000 new nurses and over 15,000 new doctors registered and licensed and practicing in Ontario. While these are great achievements, we recognize that more needs to be done. And that's why we're pushing forward with the largest medical school expansion in Ontario's history, opening 2 new medical schools, the Toronto Metropolitan University School of Medicine in Brampton that has already taken on their students and starting in September, and of course York University's new medical school in Vaughan, the first in Canada, that will be focused on training family physicians. We are also creating more opportunities for Ontarians to study and build their careers right here at home. Over the next 3 years, more than 1,300 eligible students who commit to practicing family medicine in Ontario will receive free tuition, helping retain more healthcare professionals in our communities. However, there's always a however in health. However, we know some communities face particular challenges in attracting healthcare professionals. To address this, we are taking action to get more physicians where they are needed most, through adjustments to medical school placements, investments in the Northern Ontario School of Medicine, and by providing financial incentives like the Northern and Rural Recruitment and Retention Initiatives. We are encouraging doctors to set up full-time practices in underserved communities. The demand for healthcare only continues to grow. That's why we are using every tool available to attract more healthcare workers now. Through Practice Ready Ontario, we have been breaking down barriers for internationally trained physicians so they can start serving patients in communities that need them most faster than ever before. We've also made it easier for U.S. licensed nurses and physicians to begin practicing in Ontario immediately, taking advantage of those conditions south of the border that make Ontario even a more attractive place to live, work, and build a career in healthcare. Supporting local healthcare also means expanding and modernizing our hospitals and local healthcare facilities. That's why our government has been investing nearly $60 billion in critical healthcare infrastructure projects, something that many of you raised in our meetings. As part of our plan to get shovels in the ground on more than 50 major hospital developments across Ontario, these projects will deliver approximately 3,000 new hospital beds on top of the 3,500 we have already added since 2020. This year, we're also investing $100 million in additional hospital planning grants and up to $1.1 billion in additional hospital funding. This is a record 4% increase in funding to the hospital sector for a third consecutive year. And today, I am pleased to announce that our government is continuing to support municipalities with almost $1 billion in land ambulance funding, representing an average increase of 8.7% over 2024. Along with our $33 million investment in dedicated offload nursing program and by fostering innovation collaboration between hospitals and emergency services, most particularly our paramedic services, we have seen provincial ambulance offload times decline by nearly 65% since October of 2022. It's working. Our investments have also supported the growth and long-term sustainability of the community paramedicine program, with our government providing nearly $90 million in dedicated annual funding for these vital programs. Community paramedicine has enhanced local capacity and supported timely and appropriate care in your communities. With paramedics using their training and their expertise in non-emergency roles, we have reduced hospital readmission and emergency department wait times, all while improving patient outcomes. Another key to relieving pressure on hospitals has been expanding home care. Our government's $4 billion annual investment has boosted pay for personal support workers, for nurses, and other frontline providers, supporting an 18% increase in home care hours over the last 2 years. These investments are providing Ontarians in your community with more care than ever before. And as a result, we are seeing alternative level of care volumes at their lowest level in over a decade, while the need continues, which is freeing up beds and allowing people to get better, faster in their homes where they want to be. While we are making great progress in helping people heal at home and freeing up space in our hospitals, we are also turning our attention to another critical issue: supporting those struggling with homelessness and addiction. Last year at AMO, our government announced the creation of 19 homelessness and addiction recovery treatment hubs, supported by a $378 million investment. These hubs will provide comprehensive mental health, addiction, and social services support, along with supportive housing to some of our most vulnerable residents, ensuring they help protect children and families while enhancing community safety. Earlier this year, I was proud to announce that we were able to announce 9 more Heart Hubs because of the interest from you, bringing the total to 28 across Ontario and increasing funding to nearly $550 million, reflecting the growing needs for those services across Ontario. In April, the Heart Hubs transitioning from drug injection sites opened their doors as planned and have been providing treatment and recovery services to help people reclaim their lives and break the cycle of addiction. We continue to work with the remaining hubs to support their openings in the coming weeks and months, bringing more comprehensive services, including supportive housing, in communities in need. Together, we are building close to 900 supportive housing units, which is over 300 more than originally anticipated, helping people transition to stable, long-term housing. Our investment in Heart Hubs and your commitment to Heart Hubs will strengthen communities and ensure that we have safer and stronger communities by connecting individuals with the care and support they need where and when they need it. We know there is more to do, and I am reminded of a friend who said, "Nothing transformational happens in healthcare without willing partners." So thank you for being that willing partner. And under the leadership of Premier Ford, we will continue to build on our progress together to ensure Ontario families can connect to the care they need no matter where they live for years to come. Thank you again for your time and everything you do as municipal leaders to support community health and well-being across Ontario. Stay well.
Thank you, Minister. Now, please welcome the Honourable Kinga Surma, Minister of Infrastructure.
Thank you so much. It's so nice to be back here at AMO, and thank you to the entire AMO team, including the President, Robin Jones, and the City of Ottawa for hosting us once again. I've had the opportunity to attend AMO and speak many times. I remember how challenging things were during COVID. Municipalities needed rapid responses to help provide safe services. Coming out of COVID to an economy with high inflation and supply chain challenges, municipalities recognized that more funding had to be invested in infrastructure to meet the needs of Ontarians. A massive shortage of housing and declining housing starts further propagated the need for infrastructure investment to remove the financial burden from the home buyer. Every step of the way, our government has responded and provided assistance quickly. This year, we too have many challenges before us. We're facing unprecedented tariffs from the United States, increasing global instability, and a volatile market. And all of this is compounded by the pressures of Ontario's growing population. While the future looks uncertain, we know its outcome depends on the actions that we take today. For me, one action will determine where we find ourselves in years to come: securing our infrastructure capacity now. As Ontario's Minister of Infrastructure, my focus is to build roads and bridges and increase capacity in water and wastewater systems to support the construction of new homes across our growing communities. Many of you may wonder why we would ever do such a thing when housing starts are lagging. And I would say to those with doubts, we need to build the infrastructure capacity that we know we will need so that we are ready when the market rebounds. Because it will. It may not happen tomorrow, but it will rebound. Our government is moving quickly with the needed investments to make it possible for you to get the works to tender now and to start signing contracts. With our government's record investments, more than $200 billion over the next decade, including $33 billion this year alone, there is a lot to build in every corner of Ontario. As you heard Premier Ford announce yesterday, we are nearly doubling our investments in the Municipal Housing Infrastructure Program, bringing the total to approximately $4 billion to help unlock even more homes, in addition to the approximately 800,000 that we will unlock with our already announced pipeline of projects. These investments are supporting critical projects, including $35 million for the wastewater treatment plant expansion in Carleton Place, which will enable more than 1,600 new homes, $139 million for the expansion of wastewater servicing capacity in York Region, which will enable 8,000 new homes, $70 million for the town of Collingwood's Raymond Baker Water Treatment Plant expansion, enabling more than 59,000 new homes, and $2.9 million for the town of Perth Wastewater Lagoon Capacity Expansion Project, which will enable 2,500 new homes. With Ontario's population projected to increase by 4 million people by 2051, the equivalent of almost 4 cities the size of Ottawa, we know that the new infrastructure funding is greatly needed to boost our housing supply. In addition to our record investments, we're also cutting costs to get homes built faster and help keep the dream of homeownership alive in this great province. Because it's too expensive to build homes and the process needs to change, we put in place a new law this spring, the Protect Ontario by Building Faster and Smarter Act, which will reduce costs and speed up project approvals with consistent building construction standards. Since we met at AMO last year, we've made significant progress in our plan to build to protect Ontario. We launched a $175 million health and safety water stream to guarantee communities have access to safe drinking water and reliable wastewater services, especially during extreme weather events. I look forward to announcing the results this fall. We announced 50 new water infrastructure projects that will help unlock approximately 86,000 new homes across 55,000 communities. And 2 irrigation projects in Niagara Region and Leamington. I was pleased to join my colleagues, Minister Trevor Jones and Sam Oosterhoff, along with 6 local mayors and Regional Chair Jim Bradley in Niagara Falls last week, to announce $82 million to support our farming sector, boost crop production, protect jobs, and bolster our economic resilience. This investment will help farmers in Niagara and Leamington grow more Canadian fruits and veggies. We also released the latest market update, which included 28 major projects. This included projects that will help keep communities safe, like the Eastern Ontario Correctional Complex in Kemptville, with additional new projects in planning like the OPP Academy in Orillia and Ontario Place College in Elmer. Over the past year, we've also started construction on the redevelopment of the Prince Edward County Memorial Hospital in Picton and the new hospital for Winnebago Area Health Authority in Moosonee. And that's not all. We're also delivering nearly 300 capital repair projects covering every region, ensuring our infrastructure is maintained and modernized across the province. Moving projects forward and keeping our workers on the job will help us get through this difficult time. In fact, our capital plan is estimated to support 91,000 jobs annually, including 52,000 direct construction jobs and 38,000 indirect jobs. Because every worker on the job, every shovel in the ground, every project underway helps us weather this storm. Before I close, I wanted to share that our government will release details about the doubling of the Municipal Housing Infrastructure Program announced by the Mayor. We are also looking at ways to incentivize the construction and operation of water services in more innovative ways. And with that, I will say thank you to my municipal partners for your hard work and collaboration. Our government has always stepped up to be there for municipalities. Now it's your turn to meet the moment and increase our capacity to build. Issue those tenders and sign those contracts. Prepare for future growth. By moving ahead on these shovel-ready projects now, we can seize every opportunity to deliver homes as the market recovers, all while employing hard-working Ontarians. Thank you so much, and have a great conference.
Thank you, Minister. Please welcome Laurie Deschamps, President of the Oshkosh Pamachewin, the Wenjack Education Institute, along with Marcia Josephs, Executive Director of the Indigenous Institutes Consortium, for a discussion on Indigenous